Hello everyone, let's begin with the discussion of another MCQ from the topic treatment of tuberculosis. Okay, so the question is a 40-year-old man undergoing treatment for tuberculosis. Okay, and he visits your OPD for follow up. At the time, his wife states that, okay, recently he is forgetting the names of colleagues and the neighbors. Later, he recollects the names correctly or properly. So, which of the following drug implicated in this condition? So, option number 1 is ethambutol, option number 2 pyrazinamide, and option number 3 bedaquiline, option number 4 isoniazid. Okay, so this is the case of tuberculosis and he is receiving some of the drug. Okay, but problem is, so he is forgetting the names of their colleagues and neighbors, but later he recollects their names properly. Okay, so the first option is ethambutol. So this drug, it is a bacteriostatic and it produces retrobulbar neuritis. Okay, that is color vision defects. Okay, due to retrobulbar neuritis, which is a dose dependent toxicity. Okay, here the patients are unable to discriminate the red and green color. Okay, this is called color vision defect. Okay, so because of this drug is contraindicated in the children below 6 years because the children, they are unable to report this color vision impairment. Okay, so that is a problem. If it is not identified initially or very early, it will progress to irreversible damage. So that's why this drug is contraindicated in the children below 6 years. Okay, so this drug doesn't cause the above problem. Second option is pyrazinamide. Okay, it is also one of the first line anti-TB drug, and this drug mainly increases the uric acid level, that is produces hyperuricemia. So this is contraindicated in the patients with gouty arthritis. It further increases uric acid and it aggravates the condition. Option number 3, bedaquiline. So this is not used as a first line anti-TB drug. So it is mainly used for MDR-TB, multi-drug resistance tuberculosis, where there is a person develops resistant to isoniazid or rifampicin or both. That condition, bedaquiline is used for the treatment of multi-drug resistant tuberculosis, and this bedaquiline, it is acts by inhibiting mycobacterial ATP synthase. So there is no source of energy for this mycobacterium tubercle bacilli for its survival. Okay, so but this drug produces chest pain, hemoptysis and QT prolongation. That's why after administering this bedaquiline, every week we have to monitor the patient by taking ECG to look for any QT prolongation. Okay, so option number 4, isoniazid. It is a first line anti-TB drug. It produces transient memory loss. Because of this, the patient is not able to, okay, that is he forgets the names of colleagues and neighbors. Later he recollect. That is called transient. Okay, so this isoniazid is a first line anti-TB drug and it produces some of the other adverse effects like peripheral neuropathy, optic neuritis, and sometimes with high doses it produces seizures. Okay, recurrent seizures occurs with high dose of isoniazid, and in this condition, so we can treat these recurrent seizures by giving intravenous pyridoxine therapy, that is vitamin B6. Other abnormalities caused by these isoniazids are: one is transient memory loss, second one euphoria, florid, psychosis, loss of self-control, and there is a suppression of ideas or reality. These are the other associated abnormalities with this drug called isoniazid. That's why when you are giving isoniazid, we'll give pyridoxine 10 milligram per day to prevent the CNS toxicities produced by isoniazid. So in this condition, so the probable drug implicated in this cause will be the isoniazid. That is option number 4. Okay, thank you all.